So Megan here is going to help me demonstrate how to get out of a bed if you've had any other type of surgery except for a tummy tuck, because there is a difference in how to walk. Whenever you're getting up out of bed or chair or wherever you're recovering, you do want to make sure that you are not using the muscles that have had surgery, because that's going to be putting strain on that area and cause some discomfort as well. So in this case, Megan has not had a tummy tuck. She has had liposuction and a chest surgery to demonstrate how to not use those muscles to get out of a bed. So the first thing we're going to do is have her sit on the bed to make sure that we are doing this in a stepwise process and we always have control and we're being safe. So because she's had a chest surgery, she cannot use her arms to push out of the bed. I'm going to be helping her. So I'm going to help you while you swing your legs over and supporting her that whole way through until her feet are firmly planted on the floor. Okay, in this position, we're going to wait a little bit because you can feel lightheaded after surgery. You have pain medications, you're dehydrated, and it can be a cause for feeling dizzy or maybe falling afterwards. So we want to make sure that she's feeling comfortable and ready to stand. You feeling ready?
Yes.
Okay. So next, I'm going to support her under her arm while she uses her legs as her primary source to push up, and so she's not using her chest at all. Go ahead and push. Now she can have good posture. In this position, it is also important that she looks straight ahead. That can help with any feelings of dizziness. When you look at the floor, sometimes that can make you a little uneasy as well. And then we'll walk to where we need to go. All right, coming on back. It is important to get up and walk around after surgery, whether it's to get a drink of water, stand right here for a second, or to go to the bathroom, or just walk around the house, because moving is important to reduce the risk of blood clots as well. All right, we're gonna go ahead and sit back down. And then in the same fashion, we're going to move our legs back over to here, and I'm gonna support you while you lean back down. Okay, you ready? Go ahead. Perfect. Notice how she didn't use her arms at all for that. And she's in a comfortable position. So next, we're going to demonstrate how to get out of a recliner after a chest or breast surgery to make sure that you're not putting strain on those muscle groups and causing strain on the surgical incisions. So Megan's going to demonstrate how to get up after this. As you can imagine, if you've had multiple surgeries done, you may need to change this a little bit. It is important to follow your surgeon's instructions and the instructions given to you in your pre-op folder, as well as afterwards at your discharge. And to have any questions, go ahead and call us. But with this, we're going to just demonstrate with the chest. So Megan's going to first demonstrate what not to do, which is to try to get up on your own using your arms. As you can see, that's going to cause some strain and can be very tender. It is important to use a caregiver if you do have one available to help with these motions. So when we're getting up to go to the bathroom, get a drink of water, walk around the house, you want to make sure to get that person so they can assist, because after surgery you're always going to have a little bit of dizziness and definitely some soreness. We want to make sure that you do not fall. With this, I'm going to, just like before, go ahead and have you scooch to the edge of the recliner. With the chest, I typically would support her underneath her arm. However, this may cause some soreness, so do ask to make sure that it still is okay, or the patient can tell you as well if that's not helpful. But what we're going to do is, with her arms and her armpits, help her to stand. We are doing this in a stepwise approach to make sure she's comfortable before standing and make sure she's not lightheaded. Since your feet are planted firmly on the floor, we'll go ahead and stand. Do you feel ready?
Yes.
Okay. So we're going to stand. She's able to stand straight up because she has not had an abdominoplasty or tummy tuck. And she's going to be looking straight ahead to make sure that she isn't dizzy or falls. Sometimes if the patient's looking directly at the floor, this can cause them to feel a little dizzy. In the previous clip, we did show how to walk around, so this time we're just going to sit back down. Go ahead and sit down. We made sure that she was backed up completely against the recliner, so that way she doesn't fall, she knows where she's at, and then I'm going to help her to recline back.